Good day. This is our case presentation about coagulation disorder, and this will be presented by yours truly, Nandas Tasaglea, together with Ms. Kyla May Amparado and Mr. Emilson Carl Solano. So for our patient, a 30-year-old man presented in an emergency room after an accident of sleeping and falling on his knee while playing basketball. He presented with a very painful knee and swelling after the injury. Upon further assessment, the patient mentioned that he was diagnosed with a bleeding disorder from when he was a child, which was Hemophilia A. A physical examination was done and showed that the right knee of the patient is severely swollen and warm to the touch with also difficulty in moving. So to further discuss what is Hemophilia A, Hemophilia A is a hereditary bleeding condition characterized by abnormal blood clotting. It is also known as factor VIII deficiency or classic hemophilia. Factor VIII, or antihemophilic factor, is a key factor of the intrinsic clotting cascade. Normal hemostasis requires at least a quarter or 25% of factor VIII activity. According to the U.S. Centers for Disease Control and Prevention, or CDC, hemophilia occurs in approximately 1 in 5,617 live male births. This is 4 times as common as hemophilia B and affects all races and ethnic groups. Hemophilia is passed down from parents to children. It is inherited in an X-linked recessive manner. Females inherit 2 X chromosomes, one from their mother and one from their father. Males, on the other hand, inherit an X chromosome from their mother and a Y chromosome from their father. That means, if a son inherits an X chromosome carrying hemophilia from his mother, he will have hemophilia. It also means that father cannot pass hemophilia on to their sons. However, because girls have 2 X chromosomes, they are more likely to inherit a healthy X chromosome from their father and not have hemophilia even if they get the hemophilia gene from their mother. Hence, this disorder mainly affects male. After an injury, surgery, or dental procedure, people with hemophilia A can bleed more than usual. The quantity of naturally occurring factor VIII a person produces determines how frequently they bleed and how severely they hemorrhage. Normal levels of factor VIII range from 50% to 150%. Levels below 50%, or half of what is needed to form a clot, determine a person's symptoms. So for mild hemophilia A, 6% up to 49% of factor VIII is present in the blood. People with mild hemophilia A generally experience bleeding, typically only after serious injury, trauma, or surgery. For moderate hemophilia A, 1% up to 5% of factor VIII is present in the blood. People with this disorder tend to have bleeding episodes after injuries. And for severe hemophilia A, less than 1% of factor VIII is present in their blood. People with severe hemophilia A experience bleeding following an injury and may have frequent spontaneous bleeding episodes, bleeds that occur without obvious cause, often into their joints and muscles.
For the diagnostic evaluation of the patient, several diagnostic tests were conducted in order to identify if there is an underlying cause of the swollen knee. The following are the tests done for patient X. For his hemoglobin levels, which is 5.6 grams per deciliter, which is way abnormally low for the normal levels of hemoglobin, as well as his hematocrit levels, which is 15%. For the platelet, which is within the normal value of platelet count, as well as the prothrombin time. Another abnormally way out of the normal reference range is the partial thromboplastin time, which is a test done in order to determine if there is an abnormality in the clotting factor of the patient, which this test confirms that patient X has hemophilia A. Another test that was conducted, which is an X-ray. An X-ray shows no fractures or bone abnormalities besides the accumulation of blood within the knee. For the treatment plan of the patient, the first thing that we are going to do is the clotting factor replacement therapy. This administers intravenous recombinant factor VIII concentrate to replace the deficient clotting factor. Determining appropriate dose of medication based on severity bleeding and the target factor 8 activity level. For the pain management, which is the second treatment plan, prescription of analgesics and non-steroidal anti-inflammatory drugs to alleviate the pain and decrease inflammation. Also, the application of ice packs to the swelling knee to relieve swelling. For the third treatment plan, which is joint aspiration and compression, this is the removal of blood in the joint by joint aspiration. Application of compression bandages and using joint immobilization technique to prevent further bleeding and promote healing. For the last treatment plan, which is the rehabilitation and physical therapy. Rehabilitation exercise to restore the range of motion and strengthen the joint, emphasizing the importance of maintaining an active lifestyle while minimizing the risk of joint injury. These are the treatment plan for the patient in order to have a better recovery and to prevent the future accumulation of blood and joint problems in the patient's knee.
Moving on for our outcome and follow-up. Appropriate treatment and prompt diagnosis will lead to the recovery of the patient. The treatment plan alleviated the pain, reduced the swelling, and restored the mobility to the patient's knee. The patient is advised to continue to the treatment plan to prevent future bleeding episodes and maintain joint health. The patient is recommended to be physically active. Before we move on for our conclusion, I am going to discuss or briefly discuss one of the diagnoses our patient had, which is the acute hemarthrosis. Acute hemarthrosis is the condition of articular hemorrhage into the joint cavity. This can happen following an accident or most typically in bleeding disorder or diseases like hemophilia. Acute hemarthrosis is typically treated medically with factor replacement and analgesia. For our conclusion, complication and coagulation leads to challenges on an individual's treatment, which leads to focusing on the bleeding disorder together with acute hemarthrosis for an effective management. A multidisciplinary approach is required that involves hematologists, orthopedic surgeons, and physical therapists to improve the health of the patient. Following the treatment plan will improve the overall well-being and quality of life of the patient. And that sums up our case presentation involving coagulation disorder, specifically hemophilia A. I am Kyla May S. Amparado together with my team, Tessa Nantes and Emerson Solano.